If you've been told you have a bulging disc, or if you've got back pain that's radiating pain down one of your legs, or both, I'm going to show you my favorite exercise for relieving this kind of pain. So if that's you, stay tuned. I attended a workshop back in the 1980s by a physical therapist from New Zealand named McKenzie. He developed a series of exercises based on his experiences that was counter to everything that was being taught at the time. These exercises are now considered an essential part of back care. So those are the exercises I'm going to show you here. Now, these exercises were based on the principles of how a disc swells. So before we get into the exercise, I want to explain a little bit about the disc and what exactly happens so you understand how the exercises work. I have a model right here of two spinal bones and the disc, and you can see the bone, the disc right here in the middle. And here is a nerve, we call this a nerve root. And notice that it comes out from in between an opening between the spinal bones. And what I want you to see here is there's plenty of room for that nerve to come out from in between that opening there, okay? That's a normal. This next example is a bulging disc. And what you're seeing here, let's see here, right there would be considered the bulging disc right there. Okay, you can see a little better picture of it there. Notice how it's now putting some pressure on that nerve, actually bulging on there. One important thing to note is you can have a bulging disc for years before it becomes symptomatic as far as pain is concerned, because that nerve still has plenty of room in there. So that disc has to bulge to a certain point or irritate that nerve in a certain way before you start having symptoms. So don't think that just because the pain started yesterday, that's when the problem started. It could have been there for years and years. So what we want to do is deal with this bulging disc. What will happen many times, people are walking sideways because what the body is trying to do is pull you away from that bulge so that nerve has got some extra room. So what I'm going to talk to you next about is the principle of the jelly donut. If you bite into a jelly donut, where does the jelly squirt out of? The back side, because you're putting pressure in there and the jelly will often squirt out of the back if you're not careful. Well, look at the disc, similar to a jelly donut. Inside, there's a pocket of fluid, which would be the jelly. The outer portions of the disc would be the donut part. What happens when people have this herniated disc or a bulging disc? Here's the front of the spine, here's the back of the spine here. If you are leaning forward, it is going to feel better at the time because you're taking some pressure off of that disc. That's why a lot of people are in a forward hunched position. They can't straighten up. However, over time, if you keep doing that, it's going to keep putting pressure on the front of the disc, squirting the fluid out to the back. So the principles of the McKenzie exercise is doing the exact opposite, where you have to lean backwards, and what you're trying to do is slowly push that fluid from that swollen area to the front of the disc and get it off of the back. So it might cause some temporary pain as you're coming back, but by doing this repeatedly, you're going to actually start getting some of that fluid out of there, pushing it off of that nerve and getting some relief. In this video, what I want to do is demonstrate the McKenzie exercises. And what I want to stress is you can do this at home, at work. You don't have to be in any specific gym clothes or anything. As you can see, I'm dressed in my everyday work clothes. So you can do these lying down, you can do these standing up. I'm going to demonstrate for you lying down to begin with. And So you want to start off facing down, and depending on your level of pain, if you're in severe pain, basically you want to just bend backward at the waist, keeping your pelvis on the table, and you're just bending from the waist upward, just as far as you can go comfortably. And you're going to repeat that. The goal is to try to do this 10 times, but again, depending on your pain level, just as many times as you can comfortably. And what you should find is that every time you do that, maybe you can start going just a little higher and a little higher. Eventually you want to try to be able to go all the way up on your hands, if possible. And on the very last one, you might want to hold it for anywhere from a few seconds up to 10 seconds. And then always bring yourself down in completely rested position between going up. So you come up and then bring yourself all the way down, let yourself rest, and then you're going to repeat that about 10 times. And as I said, what you should find is that every time you do that, you're going up a little higher and a little higher. If you're doing that several times during the day, you'll find yourself actually being more and more mobile as the day goes on. Because what that is doing is slowly squeezing and compressing some of that fluid and taking it off of that nerve. Don't be surprised if the pain moves as you're doing that. So it might start off in the back and you actually start feeling it going down into the leg. The pain moving is actually a good sign. I always look at that as a very positive thing. If we can move the pain, generally we can get rid of the pain. Now let's do the same thing in a standing, so you can do this while you're at work. Basically you're repeating the same activity and you're just going to be bending backwards. Now if you're in a severe pain situation, you're probably not going to be able to do this. So we're talking about once things start getting better, you can start doing this easily. Go at home, just back like that 10 times. Always coming back straight and erect, and then come back as far as you can go comfortably. And that last one, you might want to hold it for just a little extra time there, up to 10 seconds. And then that's it. Simple as that. By doing that on a repeated basis, you should see some improvements coming along. Now, the last thing I want to say about this is certainly not something that's going to work 100% of the time for everybody. You try it, do that several times. If you don't see anything coming along as far as making some improvements, then maybe that's not the right exercise for you. So don't think you're going to just keep doing it and making it worse. Please don't do that at all. One thing you might want to do is start using some ice as well in between your exercises. There's another video on my website on the proper use of ice. A lot of people do not use the ice appropriately, so you might want to look at that. And then of course, if none of this is working, you should consult somebody about that. If you're local here, please give us a call. I'm available. Would love to see if we can help you. Feel free to send me a text message. All the information will be on the video there for you, or give us a call. I'm here to help you in any way that we can. Thank you and God bless.